Hello and welcome to a video of mine. My name is Daniel Hall. I'm the founder of my own business. This video today is just to talk about the COVID pandemic, the UK COVID pandemic, and obviously the impacts it has had on myself, and also just to go into details about my participation in the UK COVID inquiry. So I just want to explain a little bit about that as well. As you can see, I've got my Christmas tree up, and as you can see, it's all flashing. If I turn it around, there it is. And if I just so obviously, I just want to talk about the COVID inquiry. Now, obviously, going back to the COVID pandemic when it first began, I can remember that obviously there was a lot of media coverage, of course there will be, when a COVID pandemic hits. But obviously over time, obviously the advice was to get tested. Because there were loads of queues of people, that I didn't wait in a queue. A lot of people queuing outside of doctor's surgeries to obviously go get the vaccination done, their injection. And me personally didn't want to wait in that queue, you see. So it's dragged on and dragged on. And even today, I'm still no better off because I still haven't had my COVID vaccination. So that's one thing that's obviously impacted me. So because of the COVID pandemic, that's one of the things that the doctor's surgeries, the GP surgeries are very busy, and I don't want to be queuing outside of doctor's surgeries, nor do I want to be messing around, obviously, and whatever. But the general advice that I was given is that I would be advised by my doctor if I needed to go for a COVID vaccination. So that didn't happen because obviously due to personal reasons. So it's dragged on, and I still have not had my COVID vaccination as of yet. But I can confirm I have had my flu vaccination, so I am protected in a way from flu. I had that done this year. In fact, I managed to go have my flu vaccination done, but I still, as I say, still haven't had the COVID vaccination. I came across an interesting thing. Basically, the UK COVID inquiry talking about wanting people's feedback on obviously the COVID, how it's impacted them, and other things. And even though I've not I've not caught COVID myself personally. Um, I, Everyone does get impacted in a slight way, even if it's just from reading articles in the press or in the media. So for me personally, I would say I was impacted because I didn't want to wait in queues, and other personal reasons. So basically the COVID inquiry is to try and find out what people think of the COVID pandemic, how it was handled, and other things, because that's how they'll learn and whatever. So I thought, well, I'll have my feedback on as well. And obviously, I just mentioned that in my case, it was that I didn't want to queue up, obviously, for busy doctor's surgeries to get a vaccination. Obviously, explain a little bit about the personal situation of not being able to go get mine done personally. But even today, it's November 2023, and I still don't have a COVID vaccination. But I have just received a confirmation from the NHS that I will be going for a vaccination eventually. Obviously, it's just been a bit late, so That's really what it's about. So this inquiry was just to find out if it's impacted me in any way. Do I want to share my own feedback on it? What do I think about the COVID pandemic from what I've read in the newspapers, on TV? What do I think about how it's been handled and that sort of thing? And I said, well, obviously, I think that it should be more accessible to get the obviously the vaccinations and flu jabs and that sort of thing. But I also think that that obviously it could be handled better by managing the surgeries, the doctor's surgeries, so they're not just queuing up outside. There is a proper process where every patient gets their vaccination, and that would avoid maybe just a general appointment or something like that, or whatever. Because only a doctor's surgery, I can only imagine, can take so many anyway. So from my part of view, I think I was impacted because obviously the accessibility to COVID testing, so getting tested for the COVID, it was challenging, quite difficult to do, especially the first part. I was even thinking about going abroad. Obviously, the airports at the time were having COVID things, so you had to have a certificate before you could board the plane. So they'd have like COVID things at the airport, and you would have to get tested. Obviously, produce a certificate to say that you can. Obviously, you haven't got COVID, and then again, when you get to the other end, you've got to obviously when you get back as well. So it is quite complicated in that sense. But I do think COVID hits the headlines a lot. Obviously, makes people who've got anxiety, depression, a lot more anxious, a lot more stressed, because obviously people were wearing face masks and so on. So I just passed my general feedback on how I thought about the COVID pandemic. As I said, that the access to COVID testing was one of them, but also number two, the top obviously having ready-made testing kits, so not just for a short period and then suspending them, but on a long period where you can obviously get them, buy them, and obviously keep it or buy more or whatever. That way, someone that's got COVID or gets rid of it and then it comes back again or whatever can obviously keep getting tested. So I think that would help. I do think face masks are a good idea. I mean, I did get stopped once in a cafe for not wearing a face mask. I was asked to obviously try and get a face mask before entering. So that was one of the impacts when I was going into a coffee shop. And I said, well, could I just put a tissue over me? Because it's no difference. She said, no, you've got to have a face mask. So, but in general, I would say that that alone was one impact. The second impact was accessibility to a testing kit for obviously to check out if I'm positive or negative. Because after a while they stopped doing them, and then so gradually. The other thing is that I did get tested once, and obviously I didn't have COVID, and obviously because obviously I didn't get COVID, but I do know obviously the impact obviously increased my anxiety, increased my stress levels, and obviously me obviously balancing up the probabilities of if I would have caught it or not. Definitely at that time when a lot of media coverage was taking place. So it wasn't unreasonable to be a bit stressed, a bit anxious about it, and the chances of catching it could have been I could have been quite right that I may have caught it or may not have caught it, but obviously this inquiry was just to get people's feedback in general, and obviously they keep it as feedback or evidence for the inquiry, but they don't put the name of the person that's obviously written it. So I feel like I've obviously contributed to it. I feel good about obviously participating in it, and also the feedback will help them to obviously from my own opinion. So it's always good because obviously the COVID pandemic, um, um, there were lockdowns going on, and there was obviously other things going on as well. So I would say a lack of COVID testing kits, where you can easily buy them and get tested, and obviously have accessible for some other ones as well. I think the queues at doctor's surgeries could have been prevented if it was done differently. And I think that um, I think that I don't think there should have been lockdowns, but I do think that people should have been wearing the face mask. So obviously responsibility, because obviously it's freedom. I believe obviously in human rights freedom, and obviously if the government say, well, you've got to wear a face mask because of a pandemic, there is human rights as well, and that human right is to obviously to choose what you're gonna wear and whatever. This obviously the country shouldn't tell people how to dress or whatever, um, or whatever. So I know that sounds stupid, but that's true. So basically, with wearing a face mask, obviously due to health and medical reasons, yes, elderly people can catch it and they are vulnerable, and all that. But again, it's freedom of choice. If someone's gonna go out there not wear a face mask, that's up to them. That's their choice, but they choose that risk by doing so. The other person that goes out there and doesn't wear one, that possibly could spread it. Obviously, it isn't ideal, but it shouldn't be compulsory to say you have to wear it, or you'll get a fine. I think it's personal choice. It's down to the other person to take that responsibility to protect themselves. And it's down to the cafes, restaurants, and all that to clean the tables and all that. Now, if someone walks in, hasn't got one, for example, that should be their choice, their human right, personal freedom. And if someone does catch COVID because they're not wearing a face mask, that's personal, obviously, responsibility. So it's down to the person to make that choice if they're going to wear one or not wear one. And they take that risk a bit like if you signed a contract or whatever. And that's how I see the obviously pandemic and how to handle it. That way, you don't get a lot of restrictions. You don't get lockdowns that say you can't do this, you can't do this, and obviously do this, that, and the other. But you also put the responsibility on the people and saying, well, you don't have to wear it, but it's advisable, and the ones that don't wear it are taking that risk. But obviously, that in a way would have been a lot better instead of lockdowns and all that. Even though there is a high risk in it, the point is that high risk is down to personal choice. I mean, you could cross the road and get run over, but you take that choice if you're going to cross or not, or you're going to stay at home. So, so it's a personal choice. What every action is a personal choice. So, depending, in my eyes, if they're prepared to go out there without a face mask, take that risk. That's up to them. Obviously, then that's just they've got to expect that obviously um, not everyone will obviously comply, and maybe there are reasons behind it. Sometimes there may not be, but me personally, I do think face masks can be a good idea in terms of obviously not spreading germs. But obviously they are obviously quite irritable obviously on the mouth and that, and irritating and that. So this is me, Daniel Hall, talking about the COVID pandemic over the last couple of years. Luckily, I didn't get any fines. Thank goodness for that. And obviously, most of the time I did obviously get a face mask, but there were times, obviously, when obviously face masks weren't needed. So from myself, Daniel Hall, this public inquiry, the UK COVID inquiry, was just to get feedback on what people thought about the COVID pandemic and all that, and I contributed to that inquiry by going onto the website, participating, filling in a very short survey of obviously certain questions, and it was submitted. It'll be used as part of the inquiry, but without obviously the name put in it. So obviously it'll be anonymous and whatever. So for myself, Daniel Hall, I managed to find that through social media, which was quite a good thing, really. It's always good to contribute if you've experienced something you may have been impacted in a way. It's always good to just try and pass that feedback on because they can obviously learn from that, and so on. So thank you for watching. Obviously this short video, it's obviously just under 20 minutes long, so not too bad. Thank you again, and goodbye for now.